A hernia is a hole in the muscle of the abdominal wall that's not supposed to be there. We see a variety of different types of hernias in our practice. Two of the more common types would be a hernia at the belly button or the umbilicus, and hernias in the groin or inguinal hernias. We also see other hernias of the abdominal wall called ventral or incisional hernias, and hernias in the diaphragm, which is the muscle that separates the chest and the abdomen. Hernias can cause pain. Structures that belong within the abdomen can push up into the hernia and become stuck. This can become a surgical emergency if we can't get that structure, whether it's intestines or something else, to go back into the abdominal cavity where it belongs. If you're experiencing acute pain from a hernia, you may need to proceed to the emergency room to be evaluated. If a hernia is not stuck but can be pushed back or reduced into the abdomen, typically those hernias can be seen in the office and can be treated electively. Many of the hernia repairs that we do, we will utilize mesh. Mesh is a man-made material, either polypropylene or polyester typically, and we'll insert that either in between the layers of the muscle or beneath the muscle in order to give us a stronger repair. With the use of mesh, the chance of the hernia coming back in the future is usually much less, as opposed to doing a primary repair where we would just suture the muscle back together. One of the newer techniques in repair of large hernias of the abdominal wall is called component separation. With component separation, we will make an incision where the hernia is located and then separate the layers of muscle in the abdominal wall. We'll actually bring the muscle back to its natural position. Oftentimes it's moved away because of the hernia. In between the layers of the muscle, we'll place a piece of mesh in order to give a strong and functional repair to the abdomen. This can result in better outcomes for the patient, both in terms of their ability to use their abdominal muscles, and also the recovery can be quicker and less painful with this technique. All of the surgeons in our office have experience with a variety of different types of hernia repairs, including laparoscopic repairs, open repairs, and the component separation technique. By coming to our office and sitting down with one of the surgeons, you'll be able to have a discussion about which type of hernia repair is best for you in order to obtain the best outcomes and the quickest recovery.